So you're always trying to, again, go back to that green level. So there's things you can do, stretching, active recovery, a good dynamic warm up to keep yourself in that mild yellow, I'll say, towards green. And that's going to be the important key. And sometimes getting some help in this yellow stage so it doesn't go to red is important. So if you have this ache and pain that just is nagging and lingering and just doesn't seem to go away, it is a good idea to consult with someone and see if there's something that in your routine that you can do differently to get you back to green or prevent it from going further into the red stage.
Welcome to the LubDub Show, everyone. Brought to you by the Providence Heart to Start program and the Oregon Brewery Running Series. The LubDub is a weekly podcast, an interactive video show where we talk to experts about all things running and walking and hear from some Heart to Start program champions who provide motivation and inspiration on this 12-week fitness journey where our communities unite in making 2021 the year that we become our best, healthiest selves. My name is Nathan Freeberg, your host, and I'm also the co-founder of the Oregon Brewery Running Series. And since 2016, we have been hosting untimed, family-friendly 5K running and walking events that start and end at breweries all over Oregon and Southwest Washington. And you know, the Oregon Brewery Running Series is really all about community. We were founded and built and have grown on this foundation of community. And we are so excited to have expanded that community with this partnership with the Heart to Start program and the training program for the goal event. And we just can't wait to make that happen. We're so close. And while we can't be together in person, we really do hope that distance can make our hearts grow stronger. As I mentioned, this is week 11 of the LubDub Show. Be sure to go back and listen to past episodes for some great training tips from experts and advice on topics that aren't just limited to running and walking. We've also talked about motivation, about the mental side of this, nutrition, and a bunch of other stuff that I have found personally just incredibly fulfilling and really kind of help a lot of things in my life. So I'm learning quite a bit as we go here. Last week, we got to hear from Nikki Streely, who is a registered dietitian, and she shared a plethora of information with us about the importance of vitamin D, proper eating, nutrition, what to eat before, during, and after your run, race, walk, workout, whatever it is. There's some gold nuggets there. In this episode, Laura Whiting, a PA with Providence and the Heart to Start champion for the Hood River Group, is going to be here joining us, giving us some words of advice. And then our main speaker for the evening is Eric Marchek. He is the clinical operations manager for the Providence Sports Medicine program. And we actually spoke with Eric back in week 3, I believe it was, about stretching. And tonight he is going to talk to us about aches versus pains. How do we pay attention to our bodies and understand when, we might need a little bit more help assessing what this little pain means, or this little ache, or this little thing over here that doesn't quite feel right, that discomfort. What does that mean? This is going to be a great episode for especially newer runners or walkers, people that, perhaps are newer to this or getting back after, some time away. Maybe they're not quite sure how to interpret these things. But also, and I'm really excited about this is going to be a great episode for people like me who maybe have been running for a long time and have either, just gotten used to, that's just my Achilles always is going to hurt, or this idea of toughing it out. Eric's going to talk to us about what all of those things mean and what to do if it's, preventing us from doing anything. So, Tracy, do you have any announcements for us this evening?
Thank you, Nathan. I wanted to say hi when I haven't had any announcements for a couple of weeks, so I miss everyone. But 2 things. One, we do have a theme week. I just want to throw that out there. It got posted in the group. And next week, even though the Super Bowl, traditionally we have this fun NFL fan fanatic in Portland. It's usually right before the Super Bowl. But the Super Bowl this year is happening during our goal event. And next week is reserved for special things. And so we're going to honor our fun NFL tradition this week. So yes, there are only 2 teams left. Maybe your team didn't make it, but don't put the gear away yet. Wear it proudly, share it with us. We just want to have a little bit of fun across the nation with all of these allegiances to the various NFL teams The guys usually have a lot of fun with this, but the ladies sure get involved too. So please come have some fun with us and share those photos so we can celebrate you. It is a contest, so please enter. We will be giving away 3 registrations to get those last minute registrants all added to the goal event. The second one, which is most important, why I really wanted to come in and say hello, as you'll remember a few weeks ago when we were off for a week for the holidays and we shared our messages of inspiration. So we had a handful of participants sharing a little bit about themselves and their journeys. Dr. Beckerman came in following, and we were talking about the importance of your stories and finding your stories and your whys. And we gave a little teaser then about how we want to invite everyone to be able to share a little bit about themselves via a video. And so we finally have everything set up with that. Sometimes when we have these great ideas, we're a little ahead of the game when it comes to how we're going to receive them within our system. So we have it all worked out. I put off sending out the weekly email today because I wanted to make sure that information was included in there. So as soon as we're done here, I'm going to put the finishing touches on that and send it out. But it's super easy. We just want to hear a little bit about you. It's a platform for you to be able to share your connection to this program and to the movement of walking and running and what that really has meant to you. And it's about 2 minutes is about as much as we can receive per video, but it's still plenty of time to be able to share a little bit. And we'll pull those in and be able to get those shared out as we can to our community. So please watch for that. We'd love to hear from you. I'm actually super excited about all of these videos being submitted.
Our first guest tonight is Laura Whiting. She's a PA based out of the Hood River, Oregon area and is the Heart to Start champion out there. Laura holds an engineering degree from the University of Michigan and previously worked as a pacemaker engineer, which sounds pretty awesome. But she wanted to be more directly involved with patients, so she decided to become a PA. Laura enjoys, and I'm quoting from her bio page, Laura enjoys teaching patients and their families to keep them feeling well and living long and happy lives. She says that a big part of education is helping patients understand how to prevent serious or chronic problems and serving as their guide for confusing medical decisions. Boy, don't I know about that. She also enjoys mountain biking, gardening, kiteboarding, snowboarding, traveling, and trying new cooking recipes. And I thought this was really cool. She volunteers as an adaptive ski instructor at Timberline each winter. So please welcome Laura Whiting to the LubDub. Laura, how are you this evening?
I'm terrific, thank you. How are you, Nathan?
I am fantastic. I see your name is Mick Whiting. Is that a nickname or is that your last name? Did I get it wrong?
No. My maiden name was McWilliam. And I couldn't convince my husband to take upon Mick Whiting as a blended name. So for anything unofficial, I'm Mick Whiting, like Christmas cards. And all of
I like that. I like that. Very cool. Very cool. What's it like being an adaptive ski instructor? That sounds like a really interesting thing to volunteer to do.
Yeah, it's really an amazing program. It depends on what your role is. Where I have volunteered in the past has been to help with the bi-skiers. So that's generally people who are in kind of a bucket seat and they're attached to two very wide skis. And the guide has you're tethered to that person and you basically serve as their brakes and their steering mechanism to get down some slopes and have some fun.
Wow.
So it's for a lot of the participants, it's really a spectacular program because it's through the Shriners Hospital. But what I've been told by a lot of the participants or their parents is that, for the days that they're able to ski, it's a couple of days of the year that they can do the same activity that their friend can do, when otherwise they may be in a wheelchair or pretty, unable to partake in the activities.
Yeah. Wow. That's cool. I bet that's pretty rewarding for you
it is.
to do that. Yeah.
Yes.
Very fun. I also saw that you're originally from Michigan. Is that right?
Yes. I
Awesome.
learned last week that you're from
I am Manistee
Manistee.
over here. Where are you? Are you from Ann Arbor area or?
I'm from the Detroit area.
Ah, okay. Yes, that's where Dr. Kentos was from as well, and that's like basically a foreign country for us in Western Michigan. So, but that's okay. Are you a Lions fan then? So we were talking about NFL football teams earlier, or do you not really care?
Growing up, unfortunately, most of my memories growing up are when the Lions games would be blacked out because they couldn't sell out.
Nobody was there.
Dome.
Yeah, totally.
And people from other parts of the country don't understand, can't conceptualize that actually happened. So I'm not a huge Lions fan.
Okay. Well, fair enough. Well, we don't need it. No, we don't need to talk about that. Let's move on. Put in the past. So I wonder if you could just tell us maybe a little bit more about who you are, about your role at Providence. And I think what I'm most curious about is a PA, like what is your day-to-day look like right now in the midst of COVID and all of the kind of craziness happening?
I think we've kind of settled into this new normal, if you will. My role as a PA, I'm mostly based out of the clinic, and I'm seeing patients all day in addressing either their acute problems that may be their heart, or maybe checking in on a stent that they had years ago, or maybe a new diagnosis of something like atrial fibrillation. And then I also participate in some procedures over at the hospital, and occasionally I get pulled in to do a stress test.
That sounds that sounds like a lot. It sounds stressful. No pun intended, but
no, it's wonderful.
Yeah, I bet. How did you? I mean, from an engineer working on pacemakers, adaptive ski instructor, a PA, like what was it about Heart to Start that really excited you? I mean, it seems like you have a lot of interest in just helping people. Is it that simple, or is it more to it than that? Like, tell us a little bit about why you got involved and why you continue to be involved.
Being active has been a part of my life since I was young, and has sort of evolved over the years. And I'm always trying to motivate patients, to help them in their physical fitness journey, to get them to become more active. And I think I've realized through my own sports and activities that if you have a particular goal, you're much more apt to be able to stick with a training course or to be able to follow through. So when Heart to Start came to Hood River in 2018, even though I was 4 months pregnant, I knew that was the program I wanted to help with, and just to engage in that. So I partnered with an exercise physiologist from cardiac rehab who was fantastic, and she knew a lot of our participants, and that really allowed us to get through the whole season. I was out for the middle portion of it with a baby, and then I was able to come back for the last couple of weeks with a 6-week-old on my chest and complete the goal event. Walk the goal event. As excited as I was to become the local champion for the program, it astounded me after that year and during the season how impactful it was for me. And even as excited as I was, it exceeded my expectations. Just to see so many different varieties of people who had come out to exercise and throughout fall who stuck with the program. So, we had families where there were 3 generations of people out there exercising. I had a patient who was about 80 and his wife exercising, and a number of people who had been regular exercisers, but then maybe life happened and 25 years later, they found themselves in a situation where they just wanted to get back into the swing of something. And I really found that humbling and inspiring.
Yeah, it's amazing how many people I've talked to from Heart to Start who they're part of why they're doing it is because they are getting so much out of it too. It's like their bucket's getting filled up, and then that's spilling over, and presumably other people are kind of picking up on that. So it just seems to be a really fun theme, and that just plays into the whole Dr. Beckerman's whole thing of the paying it forward, and it's consistent. So your answer fits right in there. Something I've been asking our guests is to talk about something that's bringing them joy right now.
I would say throughout COVID, we've had a lot of board games and card games with our older daughter, and sometimes it's just been nice to sit and chill and enjoy that time, and just put everything else aside that doesn't need to happen, and have a great match of Uno. More recently, we have installed an aerial silk, if you're familiar with this.
I am
and have
not.
been playing on that, and that's been a lot of fun. I don't know if you want to see. I can bring my. I have a rolled ankle, so I won't be on it tonight.
Okay.
But
an aerial silk, is that like one of those trapeze things that you like do acrobatics on?
Yeah, it's here's the silk.
Oh my goodness, it is.
And it's one of the only places we could make it work in our house was in the bedroom. We have some high beam.
Wow.
So it's about 13 feet in the air. I'm trying to zoom out.
I think I see it. I totally know that. I was at a beer fest at OMSI when they had some of those things hanging like from those high rafters in the lobby, and those people just doing crazy things on there. Why is that not in your bio, like listed as one of your hobbies? That's pretty cool.
Well, it's only a month old. It was a Christmas gift.
Okay.
I think we need to update my bio.
Yeah, I agree.
And it's just been what's been crazy is to see what my 7-year-old daughter can do versus what I can do. Her strength to weight ratio is way higher than mine, so she'll summit it like a monkey, whereas I'm left down here.
Yeah, I can relate. I feel that.
Not to hit the floor.
I feel that way every time when we go to a playground and my kids just like fly across the monkey bars, and I'm like, "Come on, I'm in shape. Why is this so difficult?" But yeah, okay. Well, that's cool. That is the best answer I think we've had of something bringing you joy. Aerial, trapeze, silk, something. That is awesome. So
I may have a routine by the end of summer.
Oh, awesome! Hurt ankle and all. I look forward to seeing that. Laura, what word or phrase, or just leave us with something encouraging that can power us through to this second to final week before the goal event?
I would say my hat's off to you, all of the participants. You've made it this far, and to do that and pursue a new exercise program or a revisited exercise program in the middle of COVID, in the middle of Oregon winter, and then to stick with it. Kudos. I'm impressed.
I like that. Yeah, I can't remember if it was last week or the week before. Someone just said, the hard part, you've already done it. Now just stick with it. We're almost there. So, yeah, that's great. Well, Laura, Mick Whiting, thank you so much for your time. It was great to meet you, another fellow Michigander.
Thank you so much for including me, and I'm looking forward to this evening's talk.
Allow me to introduce our main speaker for this night, Eric Marchek. Eric is a native Oregonian who enjoys cycling, hiking, traveling, and spending time with his friends and family. Eric is interested in sports of really all kinds and heavily involved in developing the sports medicine program for Providence, including managing the athletic training outreach program. In his clinical practice, Eric has a special interest in injured athletes, some of us, and helping them to safely return to the sport they love. Eric has been with Providence since 2002, and now as the clinical operations manager for the Providence Sports Medicine program, he is more in an administrative role, but he continues to work with athletes of all kinds. He's been the Hard to Start primary contact for bringing all kinds of sports medicine experts to the in-person workouts over the past 4 years, and now, get this, he is the most frequent guest on the LubDub virtual show. So welcome back, Eric. If you don't know this, Eric put together the stretching, the dynamic stretching programs that you may have seen in the portal. So Eric, how are you doing this evening?
I'm doing great. Thanks for having me back. I didn't know I was setting a record tonight. This is great.
You are. This is fantastic. You're like, SNL, they give out the jackets for the 5 Timers Club or whatever. So Maybe we'll have a 2-second time guest club. I don't know. We'll have Tracy get you a special jacket or coat, or something like that. Where are you this evening? Is that a fake background or is that a
It is fake,
fancy
yeah.
workout?
No,
Oh, okay.
home, and
That's your home gym.
More interesting than my wall behind me. So
Awesome. I love it. I
set
love
the
it.
mood, though. I thought.
Yeah. It's perfect. So if I could summarize very quickly, the last time that you were here, we talked about stretching because I think this is a really good warm up into this conversation here today. So you can correct any of this. Basically, you said like before you go out for a walk or a run or any kind of activity, a dynamic stretch of some kind is probably a good idea. That's like lunges or squats or just kind of get your body moving in some way before you start moving it harder. And then after, you said basically some form of static stretching, if it feels good and if you like it, is probably okay, but it's not, the end all be all. Is that sort of accurate?
Yeah, no, I think that's pretty good. The dynamic warm up is basically any way to activate your body and tell it you're about to work. And so if that's doing some lunges, some squats, something like that. Some people like foam rolling right before they go for a run. Basically just telling the body you're going to do some work and then go out and do your work. And then the stretching is part of an active recovery where you've done your work, you've done your exercise, and then if stretching feels good to your body and you like how it feels for your next run or walk, that's great. Again, other people like more foam rolling or some of the massage guns and those kinds of things as part of their active recovery. And all are okay as long as you stick with the routine and it feels good to you.
And I got to say, I'm trying to be a student here. Since we chatted back in week 3 or whatever it was, I've been much more intentional about my post-run stretching, and I got to say, it's been really helpful.
Good.
I do it not too long, 5 maybe 10 minutes, and it feels so much better for the next day, throughout the day. And so I don't know if anyone else has been experimenting this, but it's been really, really helpful for me personally. And so thank you. I think I was just inspired by all right, I'm going to give this a try. He says it's not that big a deal, but it really does feel better. And why I wanted to kind of put that out there is because as we were emailing, I'm still having this issue with my Achilles. Like other parts of my body, different muscles feel better. But it brought up this bigger question or this bigger dilemma, if you will, is that how do you know, so I was kind of having this problem in my quad, but I started stretching it more and it felt better. The Achilles hasn't started feeling better. So how do I know, when is this just all right, this is just kind of, a soreness that comes along with activity versus, no, you need to get in and see Eric, see a PT because something is wrong here. I believe you have kind of a very helpful metaphor that might help us kind of self-diagnose this problem.
Yeah, it's one of the most often or most asked questions I get, whether it's from a patient coming in or just, friends, family, or others asking this kind of question of when do I need to see somebody? When is it okay? Why isn't this particular pain or ache going away when the rest of me feels pretty good? So what I tell people is to self-monitor. I discuss a stoplight. If you think about a stoplight, green, yellow, and red. Green means go, and that's the easy one to check off the box. Basically, say everything's feeling good, you're doing your workout or your exercise routine, and no issues, right? And you can continue, and you feel good about it. That's green, so you just go. Yellow is proceed with caution. You have something going on, but it's not really limiting you. It feels okay most of the time and bothers you sometimes, and you recover pretty well from it and doesn't really cause you much concern, but it's in that annoying kind of phase, right? And that kind of seems like where your Achilles is right now. It's just kind of lingering and not necessarily limiting you.
Yeah, it's not stopping me, and I'm also not training hardcore necessarily for any races because there are none of those. But it's just kind of it sounds like it's probably in that yellow light category to use those terms.
Yes, and so again, proceed with caution, and in that category, you want to get everything to green. So there's certain things that you can do, and whether it be a stretching routine or trying to pay particular attention to some strengthening or just modifying the routine a little bit to let it recover a bit more between active sessions, if that helps. Then, trying to, again, get it down to that green level. But it can stay at yellow for quite some time. And a lot of people, when they're trying to increase their activity or increase their mileage, they might be in that yellow phase more than in the green, especially when you're starting a new routine or, again, like I said, trying to increase your activity and push yourself to where you haven't been before. And that yellow phase is okay as long as, again, you're recovering well, it's not really limiting you, and you're still able to do everything. It's when we get into that red phase that things change.
Yeah. And so before I go to red, I have a question.
Yep.
So I was just kind of informally polling some friends about questions I should ask you. And one of them was this idea of acceptable soreness. So you had kind of mentioned, we want to get things to green, but as you're training, is there a certain level of acceptable soreness that it's just inevitable with any level of training? Like, are you always going to be sore, or is that perhaps an indication that is a red light type of a thing? Does that make sense? You get that
It
question?
does. And I'll say soreness is common and normal for any level of activity where you're pushing yourself beyond what you've done before. And that can be starting a new walking or running program. You're going to have new soreness and aches that you hadn't experienced before. And as long as you feel like it's in that yellow light phase where, it's sore, but I recover okay and I can continue to do my activity, you're still good to proceed. Where it gets tricky is if it gets soreness beyond that, where you're not recovering, or it just feels like injury versus just aches and pains. That's where you start getting more concerned. But any level of athlete is going to experience that, whether you're a professional athlete or an amateur athlete starting a new routine. Everyone gets that aches and soreness. It's common.
I've heard that like the higher level athlete you become, the more you can just sort of deal with that pain, and that's what helps you kind of achieve those higher levels. Is that true, or is or not?
I would say the higher level athlete is used to what their body responds to, the load you put towards it. So they're more adept at dealing with it in the sense that they know it's normal and they kind of push it back and not worry about it. And they are better, not always, but the majority are better attuned to, what's an okay soreness and normal from that workout versus this doesn't feel like my normal soreness, because they've done it more.
Sure. Yeah. So it seems like yellow light is where we need to focus most of our attention, right? Because if it goes to green, that's good. If it goes to red, that's bad. But knowing, and maybe this is the ultimate question that we're asking tonight is, so all of us might be in yellow right now. How do you know if it's going to go red or go green?
Right. So you're always trying to, again, go back to that green level. So there's things you can do, stretching, active recovery, a good dynamic warm up to keep yourself in that mild yellow, I'll say, towards green. And that's going to be the important key. And sometimes getting some help in this yellow stage so it doesn't go to red is important. So if you have this ache and pain that just is nagging and lingering and just doesn't seem to go away, it is a good idea to consult with someone and see if there's something that in your routine that you can do differently to get you back to green or prevent it from going further into the red stage.
Sure. Do you have a like a hierarchy or like a quick checklist of because what I'm thinking was like, okay, the first thing you start with is maybe take a day off, see if that helps. Then maybe you focus more on stretching. Then, maybe you get a sports massage, and then, kind of keep trying certain things until you're like, okay, I need to go see a PT or something else.
I think the first thing is some activity modification. If you're training and, we can make training errors pretty easily, and those errors can come in the form of doing too much, going too fast, and doing it too soon. And so if you break one of those rules, you can get into that higher yellow towards red because you've overdone it. And that's where you get in that overuse or too much strain on those tissues, and your body doesn't adapt as quickly. So first thing is activity modification. And if you've been doing a lot of running, you can dial it down. You don't have to completely rest and do nothing, but maybe you walk that day, or maybe you hop on an exercise bike and take the pressure off, or go in the swimming pool, or something to unload those joints and tissues in a different way. And if that works and you feel better, then you kind of look at your training routine and say, okay, what did I do? And you don't want to increase from there until you're feeling good at the level that you weren't before. So activity modification, and then really looking at your training program, is the first thing that I tell people to do. And then making sure you're doing something like a dynamic warm-up and some post-recovery activities to get those tissues ready for next time can really help.
So now, red zone. It's terrible. We don't want to be there, but sometimes we are. We have to take time away. We have to get some, help. I've been in the red zone before, but I've convinced myself I'm in the yellow or even green. There's a big race coming up. There's, whatever that excuses you want to make. How do you be more aware of that? I'm sure you've had, athletes tend to be stubborn. You've dealt with this before. So what are, I don't know, some helpful tips you can share? Or is it just more of kind of what you've already said about paying attention?
It is, but we can be stubborn, and just because we can doesn't mean we should sometimes. And there are different motivations, for everybody. And it could be that, I'm going to finish this race knowing that the day after the race, I can take 2 weeks off and let everything heal. And I think that's okay to a point. I think eventually, if it's really a red zone, you're going to notice that you're not moving the same. You might be limping. You might be putting stress on other parts of the body, that you start feeling aches and pains other places. And then you really have to ask yourself, what's the risk reward? Because if you have another injury, because you have an injury on one side, and then the other side's getting too much stress, and then you end up injuring that side, it can result in you needing to take further time off and longer time off, rather than, cutting your losses, so to speak. If you really are not moving well and having pretty significant pain, you do need to listen to your body. And as much as you can tell your mind that you need to take some rest, it's a good idea. And if you get to that point where you're just limping and just having a lot of trouble, you absolutely should see your doctor, check in with a physical therapist, see what's going on, and see if you don't have some bigger underlying condition happening.
Sure. So what do you think of different treatments? So you're in that red zone, you're stubborn, you're wanting to get back to at least yellow. I'm thinking of like Graston, ART, I think it's called, even like KT tape, cupping, sports massage. Like there's a lot of different treatments out there. Some of them to me seem a little hocus pocusy, witch doctor-y maybe. What is, the PT mindset in some of those things? How can they help? Is that, I have a friend who swears he just gets his weekly sports massage, deep tissue, the person like kneels on him and makes him scream horrible things, then he's fine. Like, where does that fit into some of this recovery, injury prevention mindset stuff?
It's a good question, because there is a lot of different information out there, and there's a lot of things going on with, different providers, whether it be physical therapy, there's chiropractic, which is a bit different, and then your physician might have a different bucket altogether and treatment that they recommend. It really depends on what is going on, and then what provider you're saying to address it with. But what you've described all fit into the bucket of, manual techniques and taping. We call those reset techniques, where we try to get the body to get it in an optimal environment to heal. So you mentioned Graston, and that's a technique where you basically scrape the skin and the tissues with a tool.
It's so painful.
It can be very painful. And some people find that that's helpful to get the blood flow, to kind of reset those tissues, to promote a healing response. There's other ways to do that as well. There's lots of other ways to do that. And so it's, from a PT perspective, it's what's going on, how are we going to address it, and then what you're going to respond best to. And then after those reset techniques or manual techniques, then we want to get into figuring out why it happened in the first place. If it was a training error and you just overdid it and hurt those tissues, we can get them to heal and get you back on your feet. If it's an overuse injury or you're overloading it somehow, then we have to see why. So then you might have an area of the body that might be weaker, and so you're compensating somewhere else. And that's where a physical therapist can really help try to identify that. And repetitive motions like running and walking can really bring those out in the form of injury or like those nagging kind of soreness areas. So you want to identify that as an underlying cause after you correct and fix, the pain that might be happening at the time.
Sure. I just had a couple questions come in, but before that, did you have anything more to say about the red zone? I feel like we covered kind of what that is, what to do about it. Was there more you wanted to touch on with that?
I would say, just to reiterate, that red zone is really where you're going to be finding that pain is limiting you, and it just doesn't feel right. And rather than abandon your exercise routine and just stop moving and being active, get some help at that point, or when you're in that constant yellow point, so you can continue and be successful and hopefully avoid that in the future.
It kind of leads into this question here, and then Susan, I promise we'll get to yours. I have another question on that one. So this person's saying, I've developed hip pain in the past couple of months. It's not bad while running, but I notice it when I'm not running, standing up, for example, after prolonged sitting. This makes it really hard for me to take a break from running. Advice for a person who doesn't want to stop running. I hear maybe a couple things going on in there, but since I'm not the PT, what do you think, Eric?
Yeah, the hip, especially with runners, can be several different things. And again, you look at your mileage and you look at your training schedule and see if you ramped up quickly. If you had one incident where you might have felt it on a run and then it's been sore since. Typically, if your muscles are tight and being worked and then you sit down for a while and then go to stand up, they can be tight. And so that can be just that muscle's reacting to that stress you're putting on it. But it can be something else too. So if it continues to bother you, and again, if it's limiting how you're able to exercise, that is something you should get checked out and looked at. And then oftentimes it can be pretty simple treatment if it's more of a muscular thing. You can get some advice on some different exercises and stretches to do to help it along, and then you can continue on. Gotcha.
I just had another question, similar question, but with the knee. It doesn't hurt when they're running, but going uphill or upstairs, downstairs, stuff like that. I've experienced that too with different injuries. It's like it doesn't hurt while I'm doing my activity, but just putzing around the house or something, it does hurt. Is that indicative of, a totally unrelated problem?
Not necessarily. So when we are exercising, our tissues get warm and we feel pretty good, and we got the endorphins going, and our bodies can warm up. And so we feel good while we're doing the exercise and activity. And then when we cool down, we might be sitting watching a show or a movie, and then we get up and your knee kind of creaks and feels sore. That's just tissues getting stiff and moving. And typically, if you get on a decent stretching program and work those muscles out after your injury, you can reduce some of that. But that sounds more along the lines of, if you're not feeling it while you're exercising, but you're stiff afterwards, it's going to be those tissues responding that way.
Yeah, I've even heard, so I've had like calf, Achilles, like everything down there, it seems like it's always sore. And a PT buddy of mine many years ago said, like if you're sitting down for a long time watching TV or even getting out of the bed in the morning, he's like kind of pretend there's a pencil on your toes and like basically do the alphabet to kind of warm up all that stuff. And that really helps. And if I don't do that, if I just kind of pop up, everything's just really stiff and sore. And when I do that, it's less stiff, just feels a lot better. So even to kind of your point, before you get up, if you're whatever, I don't know, some little mini tiny warm-up stretches, which has gotten worse as I've gotten older, which maybe we all have run into that. I don't know.
Yeah, we put more stress on our joints, with more mileage, et cetera. But that's not necessarily bad stress. We just need to manage it so that we can keep our joints healthy. And again, a stretching routine and a warm-up routine can help minimize some of that post-exercise soreness in between running.
Sure. So that kind of leads into my sort of last question for you, and it's about maintenance. So I'm going to be turning 42 in a couple of weeks, and I know from looking at our participant data that we've got runners and walkers that are 20, 30 years older than me. And I look at that as almost an inspiration of I want to be active into my 70s and 80s and as long as I can. So what can you share with us? And this gets to Susan's question here. What kind of daily maintenance things should we all be doing? Like, what you just said about, maybe a little warm up before you just, get out of bed or get up from a chair. Like, what can you recommend that we do, build into our activity routines to help us stay active and fit and, healthy well into our 80s and 90s and beyond?
Yeah. And the biggest key I would say is keep moving. Find ways to just move. And the don't use it, you lose it principle is absolutely true. And so find different ways to move. If you do one thing all the time, your body's going to get used to that one thing all the time. And then you'll get stiff in other areas and won't move as well there. So find times when you do a different activity that you still enjoy and get your body moving differently. That can help. But movement is the number one thing I would recommend. And, doing some of the, stretching, the soft tissue, all those things kind of facilitate that goal as well.
I've also heard like some form of strength training is just not only prevents some of these injuries and maybe makes it so people don't have to come see you, but does other stuff for, bone density and just, our cores just naturally get less strong as we get older, which can lead to back pain and stuff like that. Do you recommend any specific, I know we talked a little bit about this last time, but core or strength stuff, not to get ripped and enter,
Right.
the strongest person contest, but just to kind of maintain, some of that just functional strength type of things.
Yes, and it ties right into keeping moving and keeping active. You can have a specific strengthening routine if you like, but it's not critical. It does help, and you can better protect your joints if you do some what we call weight bearing exercises for your lower body, for example. A little different than just walking or running to get those joints protected, and same with the upper body. But it can also just be gardening and being active in your house and just staying healthy and fit by everyday routine stuff. It doesn't have to be regimented, but it can be. Again, it's whatever you can do to keep active and continue with.
I like that. My last question here, or from someone else, do you feel as you begin running or walking longer distances that you should add in a quick PT session? Almost like that should become part of your training program to keep you healthy.
I love that question. It's a great question. In my job currently, I see athletes that I'll do an assessment with them with the goal of preventing injury as they ramp up their training and do more activity. And so, yes, I think that's a fantastic thing to do. It's especially critical if you've had a history of injuries or you have something nagging going on that you're just trying to figure out, why is this still bothering me? That's a great time to go. So yes, and a lot of times you don't need a specific referral to go to physical therapy. You can just go directly to a physical therapist and let them know, hey, I'm a runner, I'm ramping up, I'm having some soreness here. Can we get a plan together to kind of help me be successful going forward so I don't get derailed on my exercise goals.
Last question. I think I've said this 3 times. This is for me though. What is going to see a PT during COVID look like? Because I know for me, that's, a huge hesitation. So maybe obviously you can only speak to like your practice and what Providence is doing, but what does that look like right now? Because I would hate for someone, it's in some ways a lose-lose, but I would hate to someone, get hurt worse because they can't go to see you or another PT.
Yeah, and that's a really good question as well. And, we don't want people to skip healthcare for other things during time of COVID, because there's other things going on with your body that you don't want to ignore. And so if you go to, I know I can speak to Providence facilities, but people are screened, temperature screened, and they ask questions about illness and contact with anyone that may have been diagnosed with COVID recently, just to get in the door. And then once you get there, and physical therapists, and they're wearing a mask, and masks are required for everyone in the building. Physical therapist is also going to be wearing a face shield or goggles while they're treating you. And then, of course, hand hygiene, all that, and cleanliness, surface, everything, all the equipment's cleaned. So it's a safe environment in the sense that you're minimizing risk. And so if you're much more likely to get it somewhere else, is the point. if you're going to, be exposed to it. Right. Your healthcare provider is not the place that you are going to be high risk.
Cool. Do you do any virtual visits? Can you even do that with PT if someone
We do. And yes, and that's another great point, because if someone is not comfortable, there is a possibility of doing that. Or if they're at high risk, just being out in the community, there are virtual visits available. And I've done some myself and had really good results, actually. So there is the hybrid model where people that don't feel like they can come in or they want to do that virtually, it's a great option.
Awesome. Good to know. I just think that's so important. And I've, heard all kinds of really bad stories of people just not being able to get, various healthcare for, whatever reason right now. And it's just, add that to the list of things that are, being impacted by this. So,
yeah.
Eric, any final thoughts for us? I'll leave you with, I'll let you have the final word here before we leave everyone for the evening.
Thank you. Yeah, no, this has been great. And I like this conversation because it always spurs great questions. And I think some great things have come up tonight. So hopefully it was helpful. Thanks for having me back. And I've enjoyed this. And, congratulations to everybody getting through the program. Hopefully everyone's healthy, and hopefully the advice and conversation tonight gets you to your goals.
Yeah, absolutely. Well, thank you so much, Eric, for your time and sharing your wisdom and everything else. You may remember this from last time, but we are going to unmute everyone here and switch it to gallery view so that we can say goodbye. I don't know if everyone will have on their cameras, but thank you so much, everyone, for joining us tonight on episode 11 of the LubDub with Eric Marchek. Some great questions about aches and pains. Hopefully none of that applies to you because you are all just rocking your 12 weeks here. We'll see you next week. Tracy and I are going to wrap things up, right, Tracy?
That we are.
So excited. All right, everybody, have a great week. We'll see you next week. Until then, be active, have fun, and give back. Have a good night, everyone. We will see you soon.
Thank you.
Good night. Thank you, everybody.
Bye-bye.